Eyelid paralysis is part of a larger problem, typically called facial paralysis. The nerve that supplies movement to the face gets damaged. You can see eyelid paralysis isolated after certain surgeries or trauma, but usually you see it with more global paralysis of the face. And for that reason, it's not something that I manage individually. Usually there's a team of people that handle this kind of problem. Eyelid paralysis is a difficult problem because your eyelids are like windshield wipers, and the surface of your eye is like the windshield in your car. And when the windshield wipers don't work, it's hard to see. And when they don't close the eyes dry out. That could lead to infections of the eye, even loss of the eye. So you have to figure out a way to improve coverage of the eye. Now, traditionally, this was done with all kinds of surgical procedures that distorted the appearance of the eyes. So what's my challenge? What's the challenge of aesthetic oculoplastic surgeons? That's to do reconstructive surgery in an aesthetic way. How do we accomplish that with eyelid paralysis? You want to do surgery that preserves the function of the muscle, yet maintains as much aesthetic appearance as possible, and this is tricky. And I've had the good fortune of working with Dr. Babaka Zizadeh and a few other surgeons who have expertise in this area. We've developed techniques and published techniques on how to accomplish this goal. So the traditional options to surgery were to make incisions, which involved incisions through the muscle that's already been weakened or damaged. And I believe anytime you manipulate the muscle further, you weaken it even more. More modern approaches are to use things like fillers to expand and lift tissue if possible, or to use surgeries that make incisions distant from the site of where the damage was done, and then going underneath the skin and the muscle to support the structures of the eyelid that will allow it to close better and function better. Now, oftentimes this isn't possible because my prime example I tell patients are, the side that's not paralyzed is like an 8-cylinder car, and the side that is paralyzed is like a 2- or 3-cylinder car. We could never make them work the same until we devise a way to increase the cylinders or make the muscle work better. But we can do surgeries that improve the situation without reducing the cylinders anymore. We have to preserve the function of the muscle that's been damaged. So the change from more traditional to modern approaches is smaller incisions at sites distant from where the muscle was weakened, and creating the most aesthetic appearing result. The main goal is function, not form or appearance. The main goal is to protect the integrity of the eye. And if that even means changing the aesthetics in a way that maybe isn't the prime objective of the patient. If it protects the eye, it has to be done. Because at the end of the day, we don't want to lose vision. So protecting the eye is number one, and the appearance is number two. So there's nothing in the world any of us can accomplish on our own, and that's true of everything in life. And it's especially true with eyelid/facial paralysis, because in reality, there are physicians, facial plastic surgeons, just like Dr. Azizadeh, who I mentioned, and eye plastic surgeons like myself who work together to kind of put things together as well as we can. Sometimes when the nerves reconnect as they're healing, when you move one part of the face, another part of the face moves. That's called synkinesis. So that requires a different form of therapy. We usually use something like Botox to weaken the muscle from spasming when that occurs. Also, there are facial and eyelid muscle therapists that train patients how to try to improve the function of the lid. Then there are general eye doctors who will work with me that really focus on the integrity of the eye itself in this situation. And oftentimes, patients are so devastated and traumatized by this that we enlist the help of psychologists, psychiatrists, to kind of help the patients through this very, very difficult time. Most importantly, the patient's family is critical because they have to be supportive and understanding. This is a problem that not only affects a person's function, how they see, how they feel, it also can adversely affect their appearance. And especially in younger patients and younger women, it can be devastating. So the team approach is really multifaceted and very critical to getting the kind of results we want.